Dr. Pomper, tell me about sarcomas, that type of cancer. You don't often hear about this. People aren't really aware of it, are they?
No, sarcomas are not very common, and they are very, very aggressive, and they're very hard to treat.
What is the most common treatment for them?
The most common treatment is surgery with good margins, with radiation afterwards, with chemotherapy.
Would you use CyberKnife to treat sarcoma?
So it really depends on the location of the disease, because you really want to give a very high dose of radiation. So it depends on how close critical structures are to the tumor and whether the surgeon's able to get good margins or not. If he's not able to get good margins, you need more radiation, and that's where CyberKnife can really come in handy, because you can give so much more radiation to such a localized area.
Can it be cured?
Yes, it can be.
How many treatments about would it take?
Well, using CyberKnife, we would use 5 treatments.
And that would be it?
Yes.
Side effects?
Well, again, it really depends on the location of the disease, but often we are able to really isolate where the disease is and have no side effects.
So if somebody comes to you with a sarcoma, what would you tell them?
Well, the first thing is I would say see what the surgeon says, because the margins are the key in terms of getting good control.
So surgery is often the first choice of treatment.
If you can, if it's not spread, and even when you get good margins with the surgery, you do need radiation afterwards.
And then follow up with CyberKnife. Why CyberKnife over any other type of radiation?
Well, again, it really depends on the location of the disease. Sometimes it's a very large area and you don't have to worry about critical structures so much, so you don't need CyberKnife. But sometimes it's in an area where there are a lot of critical structures and it's very hard to get good margins, and that's where CyberKnife really comes through.
Because it's so pinpointed and hits directly that spot.
Exactly.
Any cure rate percentage that you could give us, or?
Well, I'd say it really varies with the presentation of the tumor.